Here's something that might surprise you. Up to 75% of men who get prostate biopsies based on traditional PSA tests turn out not to have cancer at all. That's thousands of unnecessary procedures happening every year.
Those numbers are pretty eye-opening. And now there's this new test called IsoPSA that's completely changing how we approach this problem?
Exactly right. You know, for decades we've been using the PSA test like a sledgehammer when what we really needed was a precision tool. And here's what makes IsoPSA so different. Instead of just measuring how much PSA is in the blood, it actually looks at the molecular structure of the protein itself.
Hmm. So it's more like analyzing the quality, rather than just the quantity?
That's exactly it. Think of it like this. The traditional PSA test is like measuring how loud music is playing, while IsoPSA actually listens to the melody and rhythm to tell what kind of music it is. And what's really fascinating is that two people could have identical PSA levels, but completely different IsoPSA results.
Well, that's a game changer. How significant are we talking about in terms of improving accuracy?
So get this. Studies have shown that IsoPSA can reduce unnecessary biopsies by up to 45% while still identifying the aggressive cancers that actually need treatment. That's, that's potentially thousands of men who could avoid invasive procedures they don't need.
You know what I find really interesting about this? It seems to be part of this larger trend in medicine moving toward more precise, personalized approaches.
Oh, absolutely. And here's where it gets even more interesting. Doctors are now using what they call a layered approach, starting with the traditional PSA test, then using IsoPSA if needed, followed by MRI imaging, and only then considering a biopsy if necessary.
So it's like adding extra filters to make sure we're only catching the cases that really matter? What's the science behind how IsoPSA actually works?
So here's the fascinating part. It uses something called structure-based separation to analyze how PSA molecules interact with other substances. It's like, um, imagine being able to tell the difference between raindrops and teardrops just by looking at their molecular behavior.
That's such an interesting way to think about it. And I imagine this has broader implications for cancer screening in general?
You know, that's where this gets really exciting. The technology behind IsoPSA could potentially be adapted for other types of cancer screening. We're seeing similar approaches being developed for breast cancer, lung cancer. It's like we're entering a new era of cancer detection.
Well, that brings up an important question. What are the limitations we should be aware of?
Right, so we need to be clear about this. IsoPSA isn't perfect. A low-risk result doesn't guarantee you're cancer-free, and a high-risk result doesn't mean you definitely have cancer. It's all about probability and risk assessment. And like any medical test, it needs to be interpreted alongside other clinical findings.
That makes sense. It's another tool in the toolbox, not a magic solution.
Exactly, and here's what I think is really important for people to understand. This represents a fundamental shift in how we think about cancer screening. We're moving away from this binary yes/no approach to something much more nuanced and sophisticated.
And it sounds like artificial intelligence might play a role in this evolution too?
Oh, you better believe it. There's some incredible work being done combining AI with these molecular tests and imaging data. The future might be systems that can analyze multiple biomarkers simultaneously, creating even more accurate risk assessments.
That really does sound like the future of medicine, combining multiple sophisticated tools to get a more complete picture.
And that's really the key takeaway here. The future isn't about finding one perfect test, but about using multiple tools together intelligently. For anyone dealing with these decisions right now, don't hesitate to ask your healthcare provider about these newer options. The technology is evolving rapidly, and staying informed could make a huge difference in your care.